Good morning, good afternoon, or good evening. My name is John Lim, and I'm the Executive Director of the Center of Regulatory Excellence, or CoRE, at the Duke National University of Singapore Medical School, or Duke-NUS, in Singapore. Welcome to this inaugural session of the CoRE Conversation. I'm particularly delighted that we can launch this series with our first distinguished guest, Ms Emer Cooke, Executive Director of the European Medicines Agency, or EMA. Emer has graciously and readily agreed to this interview in spite of her busy schedule during these trying times as the world continues to grapple with the COVID-19 pandemic. The CoRE Conversation will be conducted once or twice a year with outstanding global leaders like Emer, who are making a significant impact on health products and health systems regulation and policy. As a new addition to CoRE's career development programs, these conversations are aimed at enabling us to discover more about our guests' life journeys and how their unique experiences have influenced and defined their careers. The over 200 people who registered for this session on Zoom comprise mainly participants and alumni of our education offerings and who are based in Singapore and the Asia Pacific. But we're also happy to welcome a much wider audience from around the world, both on Zoom and LinkedIn Live. We hope that this conversation and what you hear today can better prepare you to move forward as next generation leaders. There will be an opportunity in the last 10 to 15 minutes for you to pose your questions for those who've registered on Zoom using the Q&A function at the bottom of the screen. We were inspired to start the CoRE Conversation with Emer as she assumed leadership of the European Medicines Agency just about a year ago at a particularly challenging time in world history, with a pandemic raging and urgent demand for approvals of new therapeutics and vaccines. But from all the pronouncements Emer and the agency have made over the past 11 months, there has been a sense of clear and steady leadership and an intuitive understanding of what information government leaders and the general public need to hear. It has been my own privilege to have known Emer for quite a number of years now, since the late 2000s, when I was CEO of Singapore's Health Sciences Authority, and Emer was in charge of international affairs in her earlier stint at the EMA. At all the international meetings I met her at, I was struck by her poise, her vibrancy, and her deep knowledge of scientific and socio-cultural issues. I therefore was not surprised when she became Director of Medical Products Regulation at the World Health Organization in 2016, and then when she returned to the EMA as its Executive Director in November 2020. But of course, Emer has a great deal of experience predating what I've just described, and so I would now like to let Emer herself share more about her journey and her story. Welcome again, Emer, and it's a great pleasure to have you join us for this first CoRE Conversation. And I trust you are keeping well in your new office.
Thank you very much, John. And indeed, it's a pleasure to be here. And I'd just like to thank CoRE for giving me this opportunity, and you personally, because you have played such an important role in our international collaboration over the last, it's probably 20 years now.
Yes, I think we shouldn't be counting at this point, but yes, we've had a lot of interactions, and the world has changed, I think, beyond recognition in many ways. So Emer, maybe we should jump straight into the sort of questions, because I'm sure the audience is very keen to find out more about you. And I'd like to perhaps talk about your background first. I'd like to walk the audience through more of your formative and personal background, and we would really like to start from the beginning, as it were. And I know you come from a large family in Ireland, and you're a pharmacist by training, but that's sort of the sort of basic information. Could you tell us a bit about your family background and what led you to your choice of profession in the first place, Emer?
Yes, thank you very much. Yes, so I grew up in Ireland. I went to a convent school, all girls school. where I have to say I felt it was a very progressive school. We were encouraged to be independent thinkers. I have five sisters and one brother. My father was an engineer, and he was very, he really wanted to promote women's education. So I think a lot of the educational background of my siblings came from the drive from my parents. I was pretty much an all-rounder at school. I really didn't find a real calling. I loved the arts, I loved languages, I loved science, and what really attracted me to pharmacy was the sort of the community aspect of it. And we had an excellent local pharmacist that really was very well respected within the community. And I guess the other thing that I need to say is it was a time of very high unemployment in Ireland. And one of the areas where it was clear that there was a shortage of pharmacists. So it was an area where I was pretty sure I would get a job after college. And that was one of my motivations as well.
Well, thank you for sharing that. Yeah, I think certainly the circumstances in those days were, of course, difficult. And I think members of the audience now may think that the world itself is difficult. But I think listening to you, it's encouraging to know that difficult circumstances can, in fact, be the impetus for encouraging people to move on and develop and overcome the odds and, in fact, achieve very significant results, I think, in terms of career, as well as impact and influence both nationally and globally. Are there any particular values that have guided you, would you say, through your personal and professional life, which you think the audience would be interested in hearing about?
So, well, first of all, our school motto was veritas, or truth. And I think that was a very formative guiding value. We were really taught to tell the truth and to be true to ourselves. And these things have stuck with me. I think from my own family, I got a very high ethical context, as well as a sense, a need for fairness. Because we were such a big family, there was a lot of, we had to treat each other fairly and with respect. And I think this was something that I've tried to carry through, and I see elements of it now in throughout my life, in fact.
Well, I think those are very powerful values, Emer. I mean, truth, transparency, I think these are things you practice now. Fairness, equity. I think as we translate what you have experienced personally in your life to the kind of professional issues that regulators have to grapple with these days, it's extremely significant and relevant. So thank you for sharing that. Do you think there's anything else you'd like to tell us about your growing up period? Because I know you've been through a number of career postings. I first met you, of course, when you were at the EMA, but as I glanced through your biography, I know you had been through a number of other experiences prior to that. Could you just sort of share a bit more about that?
Yes, in fact, I had a rather circuitous career, I would say. So I graduated as a pharmacist, and actually I did a master's in pharmaceutical sciences. I was trying to synthesize and drug-resistant antimicrobial. So I did a lot of lab work, and finally got my master's in 1985. And at that stage, I really wasn't sure what direction I wanted to go. I started off working in a community pharmacy, and after about 9 months, I figured maybe this wasn't what I wanted to do. And I went into regulatory affairs. I started working with a regulatory affairs consultancy. I worked with a startup company in Ireland. And then I went to work for the Irish Regulatory Authority. And I really felt this is the combination of the pharmacy background and the regulation aspects were what really motivated me. but I also was very interested in management, and I felt I wanted to have a bit more background in leadership and management. And I did a master's in an MBA, a master's in business administration, in 1988. And that changed my perspective. And following the MBA, I looked for something else to do. I actually applied for a number of positions, mainly in Brussels, because I had been working in pharmaceutical regulation, but there was a time when the European regulatory system was changing, and I was very interested in all the changes that I expected to happen. And I was very lucky to get a position in the European Pharmaceutical Trade Association, where I was working on the preparation for the new pharmaceutical legislation. And that was really a turning point in my career, because in that position, I was trying to coordinate positions across, at the time it was industry, but I then went on to do that in the public health area. So I went on to work for the European Commission. I worked for the European Medicines Agency, and this whole concept of European collaboration, moving on to international collaboration, is something that's really shaped my career since those early days, in 30 years ago, 1992.
Well, it's only a short time ago, Emer, really. So would you say that was a really key turning point? Because I think, our audience comprises a lot of adult learners from our programs. And I know we have people interested who've joined this conversation to be inspired in their choices. And I suppose trying to understand and define significant points that you come to. It's easy in retrospect, I suppose, to identify them, but prospectively to figure out that this is a key fork in the road and whether I go left or right. These are issues that people grapple with. So were there such key moments in what you've described?
Certainly there were. And I did feel for quite a long time that I hadn't found my true calling. And it was really when I went to work in Brussels, in this multinational environment, where I was trying to listen to different positions and trying to come out with a sort of to see what consensus would look like. And it was not something I was prepared for. I mean, it's not something that I thought, yeah, this is, I'd never aspired to it in particular, but actually I really enjoyed it. And the idea, you could listen to a lot of different perspectives and then you try to find a way forward through that. I think that was really when I felt, yes, this is something I can, not only is it something I can do, but it's something that I love doing. And I have to say, since then, I don't think I have not enjoyed a single position that I was in. Of course, you have your ups and your downs, but I've loved my work. And I really feel it's very important that you love what you do. Because you spend so much time doing it. It's a third of your waking life at least. So having something that you enjoy doing is and finding that thing is very, very important.
Yeah, I think that's very inspiring, Emer, because I think people would really want to be in jobs that they enjoy, that they love. And quite often, I think we're sort of influenced by what we think either our parents or our society or our peers want us to do. But it's very inspiring to hear that you decided or you knew at a certain point that this is really what you love to do, and you stuck with it and went on with it. But do you think, in terms of the kind of situations that perhaps members of our audience are facing today, that it's that easy in the current environment? I think everyone would. Well, it requires a degree of self-awareness, right, in the first instance. But then it also requires that sense that, yes, I can pursue a certain course of action that I enjoy doing rather than do what everyone else expects me to do. And did you sort of encounter situations like that? And how did you deal with it?
Yeah, so I have to say I have been incredibly lucky, but I think I've also been open to luck, and you have to put yourself in positions where where you're open to opportunities. Over the course of my career, I've lived and worked in 6 different European countries, and I was open to move. I was interested in getting experience in different countries and in different environments. But I do have to say, a lot of my career choices were because opportunities presented themselves rather than I had planned to do this. I mean, I certainly wouldn't have seen myself as executive director of the European Medicines Agency. And it was only, when I got to that stage of my career, I went, oh yes, I think I can do it. I think I can. But it wasn't something that wasn't where I felt I was headed. But I also think one thing I've learned is that there's a right time for everything. And I remember being headhunted for a particular position, and it was just after I'd started in EMA for the first time. So I just moved my family. We'd moved from Brussels to London, and just settled the children into school. And I didn't go for it. And I thought that, that job will come along again. And of course it doesn't anymore, because, the person who got it was 2 years older than me. And the job wasn't going to come along within my career. But I think it was the right thing not to go for it. But it did make me think subsequently, when different positions came up, that I thought of it. I thought, well, if I don't take this now, is there something else that is this the right time? Because you can, as you get older, it's the jobs or the positions that embrace your experience actually are less than you might think. So I think that I learned the value of timing, and I was very happy in my role in international affairs in EMA, and the position of director of regulation and pre-qualification came up in WHO. And I just thought, well, if I don't take this now, or if I don't go for it, because of course you never know whether you will get it or not, if I don't go for it now, this opportunity will not come up again. So I think it's about timing, being open, looking for opportunities, just exploring what's out there and thinking about, is this something you want to do? I've always said to myself, is this something I want to do forever? Can I see myself in this position for the rest of my life? And if not, then, what's the next thing?
So you sort of need to weigh the options, but there's a point when you just need to seize the day, as it were, right? And forge ahead. Yeah. But
I think you have to be brave. I think you have to be brave.
Right. I thought regulators by nature are cautious, but I think what we're hearing is that in this new normal, I think regulators need to, as we listen to you and inspired by you, we do need to have brave regulators as well. But Emer, as you were making these decisions in your career, were there sort of key people whom you spoke to, bounced ideas off? Were there significant mentors, would you say, or role models that influenced some of these decisions?
I have had so many mentors over my career, and I still feel, I remember myself as a young professional and people giving me advice. Some of it was regulatory, some of it was personal, but everybody, they've shaped me in some way. And I'd like to remember Sir Alistair Breckenridge, who I really, really respected. And he was such a pragmatic man. really looking to inspire new generations of leaders. But when I looked at the CoRE advisory board, actually Peggy Hamburg, Mimi, also your external experts, Mac Lumpkin, all these people have shaped me, and I count them as friends going forward.
Yeah, actually, we sometimes think that our regulatory community internationally is quite small. And I remember when the FDA first held the summit meeting in 2006, and then it sort of evolved and has eventually become ICMRA along the way. But it really has been very significant in terms of the impact as we've got to know one another, these regulatory leaders, and been inspired by them. And of course, well, Sir Alistair Breckenridge, he was the inaugural chairman of CoRE, but he's held many other significant positions, and we were delighted to honor him, even though he's passed on now, because he has influenced so many of us, I think. But I take your point, Emer, that role models and mentors are very critical. Would you talk to the audience in terms of, sometimes people say, I can't find a mentor, and I don't know who could mentor me. And if people are in that kind of situation, what advice would you give them to seek out people who can sort of guide them in their development and careers and lives?
So I think you need to look at people who you like the way they work, you like what they're doing, you'd like to be more like them, or you see that they manage things in certain ways. And maybe, I mean, certainly in the early days of my career, I was much less diplomatic and tactful than I am now. And I learned a lot about, not having to say everything right away. I learned that from people I worked with. I remember my first boss in Brussels, Nellie Baudrier, who's also passed on, unfortunately. But she used to say to me, Emer, more nuanced, be more nuanced, less direct. And that was a very powerful message. And I learned a huge amount from her as well. But speaking to next generation leaders, I think, first of all, don't be afraid to ask. If there's somebody that you admire, that you think could help you, that you see bits of you in them, ask them for help, ask them for guiding principles. You'd be surprised how many people are ready to share and want to actually pass on messages to new generations.
There's a very practical question that's popped up in the Q&A on the Zoom function, and it relates to what you described earlier. And it says, how do you balance all these wonderful opportunities versus the need to relocate your entire family? And how do you convince family members who prefer not to relocate?
Well, I have a wonderful family. And my husband and both of us were interested in moving around, and we took it in turns. So it wasn't nobody's career came first. It was whatever opportunity presented itself, and we worked together to make it work. And it was relatively easy to move with small children. Once the children got into, what would I say, full-time education, the continuity, it was I felt like it was time that we stayed in one place for a while. And we stayed in London for 14 years. And then, once the kids had finished school, then it's another opportunity. And you've got different things to think about. So again, it's about timing, and different things are right for you at different times for your life, but it does help to have a supportive family.
Thank you, Emer. Let's move on a bit more to delve a bit deeper. There's a question here. Are there any particular projects or achievements in your career? And you've mentioned your varied experiences over the years, but any particular projects or achievements to date of which you are particularly proud?
So I worked in the, when I started to work in Brussels, I worked as the International Conference of Harmonization coordinator. So I worked on, I was responsible for the industry coordination of the industry perspective. At that time it was really US, Europe, and Japan. And later on, I went to work for the European Commission, and it was a time when we had 10 new member states joining the EU. And I used the experience of the industry and regulators working together on priority issues to organize what became the Pan-European Regulatory Forum. And this was a forum where regulators who are already in the EU worked with regulators who were joining the EU on priority topics to really prepare them for enlargement and joining the EU. And I'm very proud of that proposal because it actually then translated into 3 PERF programs and really had an influence not just on the countries joining the EU, but on the countries in the EU, because the idea that all regulators would work together is something that I think we've taken forward in a number of ways, including in the International Coalition of Medicines Regulatory Authorities, which I have the pleasure to chair at the moment.
So in some ways, you laid the groundwork for this in your earlier career, and in a sense, we are reaping the benefits of it now. And it's been particularly important, I think, even in the last 2 years, right, in the course of the pandemic. So it's interesting, this project of which you've contributed to has been one of those foundational blocks in terms of the kind of regulatory collaboration we see today. So congratulations on that, Emer.
Well, thank you, John. Now, I'm not sure I can take all the credit at all, but it was a very interesting project. And actually, I need to give credit to Patrick Dubois in the European Commission, because it was he who pushed me to do it and basically sort of said, write something and make it happen. And so I did.
Well, very good, Emer. Let's take more questions and advice. And there's one here. And of course, we know that you didn't really start off planning, I'm sure, to be a regulator as such. But this question says, as a role model within the regulatory field, what advice would you like to share with people who are interested in pursuing a career as a regulatory professional? And I know in CoRE, in those who attend our programs, we are finding more and more people who are in other parts of the ecosystem, as it were, and are seriously considering a move into regulation. And that's a very positive thing. But could you give some advice on how people can make that kind of decision to move into regulation?
I think for me, it was organic. I have no formal training in regulation. It just ended up being something I liked and something I learned. But I see some wonderful courses, including the CoRE program, where you can come from all different backgrounds and get an introduction to the whole field of medicines regulation. And I don't think you need any particular background. I think it sort of helps if you have a scientific background, absolutely. But it's the interest and the it has to interest you. And I think there are some great programs out there internationally where you can see if this is something that you might like to do and build on your experience. Whatever your experience is, you'll be able to use it in some way in the wider international regulatory setting.
I think that's very true, Emer. I was at another virtual meeting the other day, and of course we were commenting that regulation now is very different from regulation 10 years or 20 years ago. And when I was in HSA together with my chairman at the time, we wrote a thought piece, and he had this provocative statement at the beginning, which said, regulation is as exciting as watching grass grow, which of course means it wasn't. But that's very far from the truth today. And in fact, I think we need really excellent people in the regulatory profession because of the challenges that we're facing, not just in the pandemic now, but as we look to the future. Well, thank you for sharing that, Emer. Now, you've had wide experience in international affairs, including at the WHO. And increasingly, where we are in CoRE, we advocate that a regulatory career cannot just take a siloed worldview, which is disconnected from wider health systems and global socio-political and cultural issues. What are your views on this? And could you share your advice for those who are looking to make a positive difference on public and global health?
Yes, and I think that's really, really important. One thing that I've learned as I've had a primary regulatory career is that regulators talk to regulators, but the real world is not just about regulators. So if we want to have impact and make sure that what we do reaches the patient appropriately, we have to work with a wide range of stakeholders, and we have to get out of our comfort zone and understand that what we're doing in the end, this is about access for patients. We have a regulatory role to increase access to safe, quality and effective medicines for patients. But there are many other players that we need to work with. We need to work with patients, we need to work with healthcare professionals, we need to work with policymakers, and they don't all think the same way as we do. So part of the experience and part of making our job relevant is understanding the context in which we work. And so if there's an additional work that needs to be done by health technology assessment bodies or by payers, we need to understand what evidence basis they are looking at, because we need to make we need to make our work much more interconnected. And I have to say, when I started off as a regulator, that was not what I was taught. I was taught that I looked at the quality, safety, and efficacy, and that was it. And now I think, no, you have to go further. You have to think about what this means in the end, because there's no value in a product that never reaches the patient.
Could you also share a bit, I mean, in the course, again, of the last 2 years, as the pandemic has raged, terminologies that were oftentimes just used by regulators are now being spouted by everyone, by governments, political leaders, the general public. And I think, building on what you're just saying, are there any particular thoughts in terms of how things have changed or are changing in terms of what you just described, the way in which regulators need to really interact with this wider community of stakeholders, and even perhaps beyond what we even think of today?
Yeah, I think we've become a lot more visible as medicines regulators now, and everybody is watching what we do, and everybody has an opinion on it. And that comes with opportunities and challenges. So it makes us have to explain what we do. So I think we have a responsibility to be transparent. We have a responsibility to be science-based, but we have a responsibility to communicate in a way that reaches our wide range of stakeholders. And I think we've never had to do that. So we've never had to do that quite as much as we've had to do over the past 12 months. And from our side in EMA, we have invested hugely in social listening, in interacting with different social media. We've held public hearing, stakeholder meetings where we've invited everybody the world to join us for the stakeholder meetings. And our first meeting, we had 3,500 participants, which we would never have had anything like that before the pandemic. So we've also had to increase our efforts in communication. We've also had to look at this. There's a huge amount of misinformation circulating. Some delivered, some not, but countering the misinformation is also something that I don't think we'd ever really thought was part of our job before, but it clearly is.
So there are lots of new skills, and communication, I think, is one of the things we hear very often, that it really needs to be a new skill set. And even the way in which communication is conveyed is something that needs to be strengthened a lot more. While we're still talking about the pandemic, of course, we wrote a piece very early on at the beginning of 2020 talking about regulatory agility, or sometimes called regulatory flexibility. And of course, reliance has definitely been key to the way in which national regulatory authorities have adapted and grown during this time period. Would you care to share your views at this point on other key lessons? You've mentioned some of them, but what are the other key lessons that regulators have learned, particularly during this pandemic, and which you think would define the way forward for regulatory authorities and regulatory professionals, both in government and industry and in other areas as well?
So I think the whole concept of collaboration and international collaboration has never been more important than over the past 18 months or so. And a lot of the achievements in terms of vaccines and therapeutics wouldn't have been possible without constant discussion between regulators and developers and governments to help to identify what was needed and to see how we could do this in the best and most efficient way. And part of this was having a common understanding of what development needs would be appropriate in the context of new vaccines, for example. We did a huge amount of work on sharing pharmacovigilance information because in a way we knew that the biggest challenge would be rolling out the new vaccines. And if we didn't have global pharmacovigilance systems to pick up any rare side effects, then we were going to have problems. And I have to say that worked really, really well. We could just pick up the phone and talk to, some countries had started 2 weeks before others, so we could learn from the experience, adapt. And there was, we had regular meetings on looking at agility, what we needed to do, what we could, where we could work together. Could we do hybrid inspections? Could we rely on inspections done by other parties? And of course, this became very important when there were lockdowns and difficulties traveling. So we needed to be much more agile and to work together very effectively. And I think what happened and what is still happening is we have moved from talking about collaboration to actually doing it in real life. And I really feel that this is a turning point for international collaboration. There's a lot more we can do. There's a lot more we can build on the successes we have here. I know people are tired. I know people haven't got as much energy as they did at the start, but we have done so much together now. There's no going back. There really isn't.
There are two related questions, one which was submitted earlier and one which has popped up in the chat. And so the first one really builds on what you've just been saying, that as we look to the future, what key lessons do we need to learn and major systems adjustments that need to be made in anticipation of future public health emergencies? And there is one which is related but maybe broader. What is your advice on developing legislation and what perspectives would you look at? So I don't know, could you sort of very broad scope of things as we look forward and also dealing with the development of legislation to address these? Could we have your comments on this?
So I think we have to be much better prepared. So we have to build in more preparation on the side of manufacturing, identifying pathogens, identifying the research needed. I think more platform type clinical trials. A lot of the trials that were done in looking at possible therapeutics were too small, and they weren't big enough to give us statistically significant results. So we need to look at how we can do more meaningful trials that will be relevant in an international context. In terms of legislation, I think we need legislation that enables adaptability. I think we've actually done very well, I think, in Europe, but we have some, we need to be more, we need to have more possibilities. So, for example, we didn't have a mandate to manage shortages, and we did this on a voluntary basis. And because it was a public good, we were able to do so. But we will have new legislation that extends our mandate now to give us a role in managing shortages across Europe. So some of the areas, some of the collaboration on clinical trials, linking research to the regulatory process, I think there are opportunities to do this better. But I'm not a great fan of very prescriptive legislation. I think we need to make sure it enables progress and doesn't inhibit progress.
Well, I totally agree with you there. Otherwise, if it's overly prescriptive and too detailed, I think it binds us and sometimes ties us into a corner, as it were, when sometimes we need the flexibility to respond to new situations. There's a comment that came up that says, Emer is a true inspiration, and thanking you for sharing your story and your commitment to public health. So I think we acknowledge that, and we acknowledge you as well. But can I now take the conversation a bit back more to your perspectives on a personal level? And the usual cliche in all interviews would be, how do you manage stress? But I'm sure as executive director of the European Medicines Agency, particularly in the last 1 year, the role must certainly have come with its fair share of many instances where you've had to deal with delicate situations or political sensitivities, which could be very stressful. Can you share with us your take on managing stress and dealing with politically sensitive situations?
I think everybody has their own way of dealing with stress. I think I'm quite resilient, but I do try to break things down and deal with one issue at a time. And I try to avoid what I call problem paralysis, because sometimes there are so many problems that you feel like you can't do something. But if you can just start to move, do one thing at a time, focus on today's problem and let tomorrow's problem come up tomorrow, I find that very, very helpful. And then the other probably more personal aspect is that when things are bad, I always try to find the one good thing. So, you know, if I've had a really bad day or there's been a huge number of conflicting issues, I go, well, what was the good thing that happened today? And I try to find something positive that keeps me motivated. But I think really the idea that you can do something good, that you can contribute to helping the European public health situation, I find that hugely motivating. And I think the challenge is you have to try and be sure that you're doing the right thing in very uncertain circumstances, and when the information is changing all the time. And that is challenging. And I definitely have had sleepless nights wondering whether we were doing the right thing. Could we do more? Could we do better? How could we do that?
Well, I think you've done very well. And as I said at the very beginning of this conversation, I've always been very impressed by the way in which you fronted sometimes rather significant issues and difficult ones along the way. But you were saying earlier on that, you know, your mentor advised you to be more nuanced in the way you conveyed things. But do you find that that could be paradoxical if you're overly nuanced in situations like today? And sometimes when there's a lot of misinformation floating around, it may actually not serve the public good, as well as being a bit more direct and blunt, perhaps, in circumstances?
I think you need both sides. You need, and you need to find the time when you need to be nuanced, and you need to find the time when you need to be blunt. And I am quite a straight talker. You probably that's probably become clear. I think being. I think the idea of being true to yourself and trying to be as clear as possible is also important. But yeah, there's also wording something in a different way might have more benefit in terms of communication than how you would see it, especially when you're working in a multicultural environment, because people take things up in different ways. You know, people aren't used to some cultures aren't as comfortable with being very, very straightforward. So you need to see your audience and try to understand what will work in that context. So it's a combination of skills, I would say, and part of experience helps you to know when it's right to do it in one way and when it would be better in another way.
And I suppose, Emer, it's helped because in your time in the WHO, when you were doing international affairs in EMA in your first stint, you've had a lot of interaction with people from different cultures. So I'm sure that feeds now into how you also sort of handle these kind of communication issues in your current role and responsibility. But I suppose it's not something that everyone has had the benefit of having, but it's clearly a skill set, I think, which needs to be developed in the regulatory community. It goes back to an earlier question which had been posed earlier, but I held off first because we've been talking about the education bit. And what the questioner says is many of us went into university pharmacy degrees with very limited awareness of the opportunities in the regulatory or industry fields. And as a result, most of us only had one direction, thinking we could only be clinical pharmacists or community pharmacists. And how do you think this can be improved? I think at the point of education, and perhaps talking a bit more broadly in terms of the skills that need to be developed now for the regulatory professional of tomorrow.
So I do think pharmacy is a very adaptable career, and it's because you do a little of a large number of things. I think that it means that you have many possible directions. I do think the pharmacy schools need to inform or help provide guidance on the opportunities in industrial pharmacy, in regulatory affairs, and government affairs, because we have quite a number of pharmacists working in these areas internationally. Of course, it's probably a small proportion of any pharmacy class that will go into these areas, but it's still important that the students are aware of the possibilities. And I was part of the School of Pharmacy in Trinity College. I was part of their strategic advisory board, and this was one of the messages that I was trying to give, that, you know, it is a very varied career. There are lots of opportunities, and people need to be aware of what the opportunities are.
Thank you for that, Emer. Well, we're jumping back to other topics now as they come through on the Q&A. There are two questions, one which I had earlier and one which is now in the Q&A section, and I'll just read them out together. What are your views on the various inequities in global access to essential medicines between the developed and the developing world during this pandemic? And I think, wearing your past WHO hat and now as Executive Director of the EMA, how can they be addressed in the short to the midterm? And there's a question in the Q&A which says, have you ever faced a problem such as people who have difficulty accessing healthcare because they live in poverty and the places they live in are too far to access the health services? As a regulator, what solution can you offer in this situation? So this is a very broad global context now.
So I think this comes back to what I spoke about earlier about being connected with the other players in the road to access, because as medicines regulators, we are only part of that road. We aren't the only solution, but we do need to understand if there are barriers to access, is there something that we as regulators can do about it? Bearing in mind that our primary responsibility is the safety, quality, and efficacy of the products. I think bringing patients into the regulatory system, understanding patient needs is very important. Also, on the access side, I think we need to understand a lot more on what it means in terms of what regulation means in terms of access. And this is something that I did learn a lot about when I was in WHO, because even very simple, inexpensive products like insulin were not available in low and middle income countries, and the ability to pay and the ability, the need to find solutions that work in these contexts is also very, very important. I think we have to keep grounded on what our role is, but in terms of helping with inequity, the sort of things that we can do, or I can help to do, is to make sure there's more production, that global supply is overall increased. We can work with regulators across the world so that if there are areas that we can help from the agency perspective, if we can help and use reliance concepts, that's something that really can be beneficial. And I think there's a lot that we can do while maintaining our basic role, but reaching out to understand if there are barriers that maybe can be addressed in some way in the regulatory system.
Thank you, Emer. Two questions were submitted earlier, and they're really talking about work sharing, and specifically between the EMA and the US FDA and even other parts of the world. Would the EMA consider regulatory work sharing, which I think you actually do already with the US FDA, but also collaboration perhaps with the ASEAN Pharmaceutical Product Working Group? I suppose this is a question from Southeast Asia. And another question it says the US FDA involvement in initiatives like Orbis is getting more established. Can you describe the EMA's plans for future work sharing initiatives? Oh, in fact, before you answer that, there's one more question that has popped up. What lessons from the EMA can be applied to the African Medicines Agency and partnerships as the AMA comes online? Perhaps you'd like to answer them all together as time is running short.
Yes, of course. So first of all, I just want to make it clear that we are committed to international collaboration and to working with regulatory partners throughout the world. We do work very closely with US FDA. We have confidentiality arrangements with a number of countries, and we work within bilateral frameworks and also multilateral frameworks, including ICH, ICMRA, and the international regulators, International Pharmaceutical Regulators program. So there are lots of opportunities where we can engage with either individual regulators or groups of regulators. We also had a very interesting project in the context of the COVID applications, where we allowed regulators outside of the EU to participate in our regulatory process. This was called the open process. It was a pilot just for COVID vaccines and therapeutics, and regulators who had confidentiality arrangements with us were able to participate. And in fact, WHO participated as an observer, and we saw some of the benefits of reliance as they moved on to emergency use listing based on some of the scientific discussions. So we're looking at how we can move that now on further as we continue to work on COVID products, but maybe there's a role for in the antimicrobial resistance area. So we're always looking at opportunities to improve our reach and collaboration internationally. And I think globally, we have to think about how we do this much more efficiently. And I would look to some of the strategic work of the International Coalition of Medicines Regulatory Authorities to really shape that going forward. And then finally, you asked about the African Medicines Agency. And of course, we're very excited to see that this will looks like it will become a reality. And we are ready to help with the learnings we have from working as now a network of 27 member states. Of course, there are learnings that we have that we can share and help in the future development.
Thank you, Emer. Just two more quick questions, which I think you can maybe answer rather quickly. One is a question on how regulators can help to address the growing issue of science and specifically vaccine skepticism. And another question, which is a bit broader, what sort of, now that we've had more time and hindsight over the last 18 months, what can regulators and industry learn to ensure better management of future challenges and crises?
So a couple of things. First of all, I think we can always improve on communication and transparency. And we need to make sure that we are communicating effectively to a wide range of audiences. And I strongly believe that regulators have a responsibility to be transparent and science-based. In terms of the types of, we are now looking at lessons learned and areas that we can improve in terms of future preparedness. And two of the areas that we've highlighted across the European medicines regulatory network, so across our network of 27 member states, is how to ensure look at the best use of resources and sustainability. So how do we do that better? Because it's clear there have been stresses on the system. And then the second one is the area of involvement with stakeholders and how collectively, when we have different roles and responsibilities, how do we engage across national and multinational fora? So those are two of the areas that we're looking into going forward.
Well, thank you so much, Emer. We've come to the top of the hour already. Time has flown by, and it's been fairly intensive in terms of the number of questions coming through, but thank you for responding to them so well and so clearly. And there was a comment that came through earlier that said, excellent discussion. It's so valuable to have this insight in the past 18 months. And of course, we know the pandemic is not over, but we can take heart from the fact that as we learn from even the last few months and as we look to the future, we can work on things together, I think, not just in Europe, but across the world. So, Emer, I'd like to let you have the last word. Are there any closing thoughts and comments you have on your further aspirations, ambitions, or final words of advice to the audience as we close this first CoRE conversation?
Well, thank you very much, John, and thank you for giving me the opportunity. It's really been a privilege and a strange way, because we're looking at each other on screen and presumably we're engaging with many more people. But I think the message that I would like to give to everybody online is that we're stronger together. If we work together, we will be able to deliver. So stronger together, my closing thoughts.
Thank you, Emer. So Ms. Emer Cooke, Executive Director of the European Medicines Agency, it's been an absolute pleasure to have had this conversation with you. Thank you for inaugurating this new series of CoRE conversations. And I wish you well as you continue in a very challenging role, but as you've already shared, what you've already demonstrated in the last 1 year certainly gives us confidence for how you will take the European Medicines Agency on to even greater heights, even in the midst of the pandemic and beyond. So, Emer, it leaves me to thank you for this. I hope that in the not too distant future, I'll be able to meet you in person rather than virtually. And we wish you well, Emer, and all the best for your very significant responsibilities. Thank you so much for joining us today. And thank you to the audience for spending your time with us and posing questions to Emer.
Thank you very much. Bye-bye.
Thank you. Bye-bye.